Hello everyone, today we will discuss about the diphtheria. Diphtheria is a bacterial infection that occurs commonly in upper respiratory tract. It is caused due to the Corynebacterium diphtheria. Corynebacterium diphtheria that release exotoxins, and that exotoxins damage the heart muscles and nervous system. In 25% of cases, myocarditis or cardiac failure that occurs. In nervous system that cause generalized polyneuritis with weakness and paresthesia. It occurs after 10 to 14 days. Okay, and death occurs due to acute circulatory failure, and diphtheria spread by the droplet infections. Clinical features. First, we know about the incubation period is 2 to 4 days, and disease begin with the sore throat, moderate fever, and tachycardia. Bull neck also give appearance of bull neck and lymph node tenderness. Okay. Diagnostic feature: vast, leathery, elevated, grayish green, membranous on tonsils that are well defined edge form adherent surrounded by zone of inflammation as seen diagram. Anterior nasal infections, nasal discharge, and laryngeal diphtheria that give signs like the hockey face and pitched cough. Okay, this is important features that you can identify diphtheria. Management of diphtheria. First we give diphtheria antitoxins. It only neutralizes circulatory toxins. You should be always remember that antitoxin will not work when toxins already reach to tissue. Okay, in case of allergic reactions, adrenaline 0.5 to 1 ml, 1:1000, and I am given, and antihistamine also will. Mild dose 400 to 800, moderate 16,000 to 18,000, and in severely up to 1 lakh should be given. Penicillin 1 to 1200 milligrams 6 hourly IV or amoxicillin 500 milligram 8 hourly for 14 days. In penicillin allergic patient, erythrocin should be given. Preventions are given by the booster dose after every 10 years repeatedly, and close contact with the patient should be given erythromycin to prevent diphtheria to spread in other peoples.